Do you have acid reflux or a hiatal hernia? Are you sometimes short of breath? Do you sometimes feel anxious? I want to talk to you today about a connection with the structural part of your body, specifically your hip and low back. And on the face of it, you think, how on earth could that possibly be connected? They're pretty far from one another. But I think you'll find the connection rather fascinating. And if this is something you suffer with, or you have the imbalances that I'm going to discuss, it could be a very important component to addressing successfully your heartburn, your hiatal hernia, and the symptoms that go with it. So along with the acid reflux and hiatal hernia, not only can you feel short of breath, which I mentioned earlier, you can have heart palpitations, you can have anxiety. There's a lot that goes with it, and the interconnections between the various parts of the body are pretty interesting. So let's jump into it, and I'm specifically going to talk to you today about first of all, a muscle called the Soaz muscle, and even though the pronunciation is with an S, there's a silent P, so it's P-S-O-A-S. So that's your psoas muscle. Now, it is what's called a hip flexor. So if you're sitting like I am now, just raise one knee to the ceiling. If you're standing, then also raise a knee to the ceiling. So the motion of doing that, that's called flexing your hip. So you're utilizing your psoas muscle when you do that action. So that's number one. Now, the psoas connects to your lumbar vertebrae, so your low back vertebrae. You have 5 of them, and it's connected to that, and it comes from those vertebrae, so from the low back spine to the inside of your leg bone called your femur, and that's the connection as to make that motion of hip flexing. Okay, so we've got that. However, or also, you have the fact that your diaphragm sends fibers from your diaphragm down to those same lumbar vertebrae, the vertebrae of your low back. And the fascia, it's called. Now, what is fascia? Fascia is this kind of saran wrap like coating to muscles. If you can think of a chicken breast, it's got that shiny coating on it. That's the fascia. It's paper thin, but it's also kind of slimy or slippery, and that's because you want muscles to slip by one another and not get sort of hung up. If you've ever heard of adhesions between muscles, that's when there's been some injury and now things are not flowing by one another as they should. So getting back to the psoas and the diaphragm, the fibers of the diaphragm, which extend from the diaphragm down to your low back, are actually interwoven with the fascia of the psoas. So they affect one another. So if your psoas is in spasm, which is very common, people tend to have a shortened psoas, so then that would be pulling down on your diaphragm. So now if it's already got a tension down and you're trying to inhale or belly breathe, you're not going to get that free motion of your diaphragm as you should, and then you're going to resort to more chest breathing. Unfortunately, what that does over time is it's going to weaken your diaphragm, and particularly it's very important that the diaphragm works well, but the opening where your esophagus, which is the tube that connects your mouth to your stomach, the diaphragm has an opening. That's what the hiatus is called, the opening, and the esophagus passes through there. Well, right where the esophagus passes through the opening in the diaphragm has a special ring of muscle that acts as a bit of a valve that can compress down on the esophagus, acting as an anti-reflux mechanism. So as soon as the diaphragm is being pulled in a certain direction, and the tension is too much on it, that valve can't work as well as it should. So that's your connection between a tight hip and having acid reflux, because of the distortion to the diaphragm. Also, when you have what's called a dysfunctional psoas, you tend to be somebody who, if this is sort of the normal curvature of your low back, it curves forward, your low back, so you have sort of a lot of curvature. Sometimes this is affectionately known as the duck butt, meaning, you know, your butt sticks out because you have a lot of extra curvature. Well, when you have that extra curve, and you can, you know, if you just stand and stick your butt out, you might know you have that just because you can see your posture. Or if not, if you exaggerate that, it puts a lot of stretch on the front of you or your core muscles. So when it's chronically in that position and the low back is too curved, it's putting such a stretch on the front of you that your core gets weak. And what that does is it creates increased intra-abdominal pressure, which is one of the leading causes of acid reflux and hiatal hernia, because we've got too much pressure within the abdomen on the stomach, and it gets compressed, it gets forced up, the acid goes up, and off we are to the whole spectrum that goes with that. Also slouching, a lot of times associated with the weak core, you're the person who's hunched over a lot. It's hard for you to effortlessly sort of hold yourself up. And that slouching, that crunching over, of course, is also increasing intra-abdominal pressure. I definitely meet new patients where, you know, when they're having the pressure and they're having the buildup of gas, you know, they just say, oh, I just stretch and I lean back, and they're just trying to, you know, increase the distance between their rib cage and their abdomen, and they can get some relief that way. But of course, we want this to happen effortlessly and naturally. So if you're somebody who slouches, you're falling into this category as well. And the psoas can be part of it. The weakened core can be part of it. Let's see what else I wanted to go over. The psoas, interestingly enough, is tied into your sympathetic fight or flight nervous system. And I was thinking about this, and it's like, okay, so like, you know, if you get that, if you lift that leg in anticipation of you're going to run, right, fight or flight, you know, you're getting into action. Certainly the hip flexor muscle is getting into action, but if it's chronically spasmed, it's engaging that fight or flight chronically. So we know that's problematic, because then you're not into the rest and digest. Your vagus nerve is now lower in tone because it can't activate. The vagus nerve is your longest cranial nerve, intimately associated with all of these valves and sphincters and the function of your heart and your esophagus and your stomach and all of the organs of your abdomen. So that if that vagus nerve is lowered in tone because you're constantly in fight or flight, then we have an imbalance that again is setting you up for more acid reflux, more hiatal hernia. So it's so interesting, right? The intricacies of this. And so of course, what do? The treatment, and one thing we have in our online course, and then of course in all our programs is, and it's really one thing that really makes us unique, is that we have a whole structural part of the program where we're teaching you how to stretch your psoas and you know, exercises to do and strengthen your core in a way that makes sense. Because if you have a lot of increased intra-abdominal pressure and then you start doing crunches or something like that, you're going to be truly miserable. You're going to have shortness of breath, you're going to have heart palpitations. That's not the right order of things. So there is a hierarchy and there is an order in which to treat properly. So you definitely have to know that. But we address targeted stretching for the psoas, diaphragmatic breathing, so we can kind of get that diaphragm engaged again. Also, any postural correction that's needed, whether it's if you're not local to us, there's things that we do online that are very effective. If you need more, it's finding a local physical therapist or doctor of chiropractic for you. And then what we do to regulate the nervous system and get you more into the parasympathetic and out of that sympathetic fight or flight. So that's working with the vagus nerve, and there's a number of very easy strategies to do that. But it really speaks to the comprehensive nature of our program, why I think we enjoy so much success is because there's a lot of facets to it. And, you know, maybe this is not a major one for you, but maybe it is. And so when we're sort of going down our checklist of, you know, what is it, that's what I try to tell people, because a lot of times they're like, well, what do I do? I'm like, I don't know you well enough to know what you need to do, first of all. And then that's what we do, is we get to know you, we get to, you know, kind of go down our checklist of what makes sense to address for you. And if you're somebody who's like, no, I never have low back pain, I'm really active, I've got a strong core, like that's not it. Great, so that's not it. We go on to what is it, right? So I hope that all makes sense. And I just thought that was an aspect that I hadn't discussed before. I've talked about the vagus nerve, but I've never talked about the psoas and the low back and, you know, this hip flexor muscle that's so intimately tied into your diaphragm and so intimately tied into your nervous system as far as fight or flight is concerned. And, you know, I mentioned the measures that we take to help normalize it. That would be in conjunction with everything else that is relevant to you when we evaluate you. So if this is something you suffer from, if you suffer from acid reflux, hiatal hernia, and any of its attendant symptoms, and you like a natural approach to your health, then of course we're delighted to help. If you enjoyed this content, please give it a thumbs up. Also, please consider subscribing to the channel. We're trying to increase our number of subscribers so that more people can see this content and get the help that they need. And I really value you. I thank you for watching. And I do answer pretty much every question that I get on my channel, so I look forward to hearing from you. We'll talk soon.